Welcome to the Medfield Podcast, where we dive into big issues shaping our world. Today, we're tackling universal healthcare, a topic that sparks fierce debate. Is it the key to equitable, affordable care for all, or a costly system due to inefficiency?
Everyone wants healthcare. Everybody believes that access to healthcare, affordable care, and access to care is a right that we should have as an American citizen. And I think that one of the biggest things that's holding us up from universal healthcare is the healthcare industry. I wouldn't even call it the healthcare industry. It's the insurance industry's lobbyists that have spent billions of dollars over the past few decades to ensure that the profits flow to them first and then pay for our healthcare.
You know, just healing people. If profit motive is the North Star,
Yep.
you're not going to have the best healthcare.
No, absolutely not.
This
Yeah.
has been proven consistently over time. You're not going to have good healthcare if you have a profit motive, and that's your North Star.
Yeah, I'm a big fan of the show Smartless, and I like how they do the banter up front, and then they have their theme song, and then they get into it. So we're gonna have to get a theme song. Every good podcast needs a theme song. It's like what you look forward to, and you know. I like to listen to my podcast in the shower. I don't know about you, in the shower and in the car. But when I hear that Smartless theme song, it gets me ready to relax and learn something, or just completely tune out. So
I listen to podcasts during the gym. That's what
nice,
I like to
nice.
do.
Do you like smart? Do you like smart podcasts where you learn something, or things like this where it's just kind of banter?
I like to learn things. I like entertainment too. It's
Nice.
ideal if I can learn something while being entertained as well.
Nice. Sometimes I just like listening to stupid stuff. Like recently, I've been listening to the Soprano Kids and their. I don't know if you've heard their podcast. It's called Not Today, Pal. It's pretty funny. It's like mindless, just banter, but it gives you a positive outlook to the day because you feel relatively smart. So it's good. But I hope people take away the same thing from this. Yeah, I'm sure there's people listening who are like, wow, this is entertainingly foolish, but still entertaining. So yeah, universal healthcare. I'm curious, Frank, with your political views, where do you fall on the universal healthcare spectrum?
So I don't completely associate with either side. I hate this idea that you're a conservative or a liberal. I agree with both sides on certain issues, and I certainly I think the fringes on both sides scare the fuck out of me. Excuse my language.
Yeah.
And I don't like the fringes on both sides. Like I don't want like super nationalist white racism on the right side, and I don't want Antifa type folks on the left side.
Yeah, but Antifa means anti-fascism, so I think you do. I don't think you want to live in a fascist state. So we need Antifa to keep us out of a fascist state, if that's what you're talking about. So let's get beyond that. Let's get back to the universal healthcare question.
Here's the thing. Hold on, I know. So let's say
because you refer to me as a leftist, right? You say, oh, you're on the left. I'm not on the left.
You're not really a leftist. I don't know. I think
I'm a centrist.
Over the ground.
I am, and even if you look at the traditional political spectrum, even Bernie Sanders is a centrist, right? He's there to soothe. Yeah, he's there to soothe the Democratic Party into I guess being accepting of the status quo because a better future is possible. But historically, Bernie Sanders is right now in the center of the aisle. The Democratic Party is on the right, and the Republican Party is on the far right. And that's just the way that it is right now politically. But I think we can all agree that everyone wants healthcare. Everybody believes that, access to healthcare, affordable care, and access to care is a right that we should have as an American citizen. And I think that one of the biggest things that's holding us up from universal healthcare is the healthcare industry. I wouldn't even call it the healthcare industry. It's the insurance industry's lobbyists that have spent billions of dollars over the past few decades to ensure that the profits flow to them first and then pay for our healthcare. So most of us pay into a system provided by our employers, which is also antiquated and needs to change. I know being an entrepreneur is difficult these days because you have to go out to the marketplace, and things like the Affordable Health Care Act that provide a affordable but lower quality healthcare option. Last year, I spent $50,000 on healthcare as an independent entrepreneur. And that's ridiculous, right? For the level of care that we got for $50,000. However, I think most of us right now are paying into a system that pays healthcare providers to stop us from getting coverage. if we eliminate the healthcare industry altogether and provide either a private or public entity that manages our healthcare and acts as a minimal go-between, our tax dollars and our healthcare dollars go much further to afford a better standard of healthcare. Today in America, we live in one of the richest countries ever to exist, and we have got like the 11th best healthcare system on the planet,
No,
which
I
is
thought it was
unacceptable.
37. I thought it was
Yeah,
37.
it's pretty bad. Whatever it is, it's abysmal compared to other countries that have universal healthcare. Even if they have to wait in longer lines, they can provide private healthcare that gets them better healthcare. But if we eliminate all the costs that's going to pay for insurance companies and the middleman, we would afford phenomenal healthcare. And that I'm done. That's the whole debate right there.
Yeah, I agree. I agree with you on in some respects. I think that I like universal healthcare, but managed by the states. Personally, I think it would just be better managed that way. But for sure, like this is really not a profit centric debate. It's more of a humanistic debate. Like, are we in alignment with humanity and what humanitarians do, as opposed to trying to just profit off of every sick person? To me, that's disgusting. Trying to profit off every sick person, or not giving proper care to sick people, and leaving it in the hands of an institution or corporation to decide whether somebody is going to get care. Where you get situations where they don't have enough beds and they need to kick patients out of the hospital, which is ridiculous. There's videos out there currently of people that have been kicked out of a hospital and they don't get the proper care, and they're not capable of functioning in general when they're kicked out, and it's ridiculous. It's a silly. I don't understand. Like, that doesn't make any sense.
Well, it's because the profits go to the executives of the insurance companies as opposed to paying for healthcare. And so I think that's something that we can all work towards. We can all demand of our representatives and otherwise. But, it would take a serious show of, political force to make it happen. Now, we were able to get to Obamacare, in President Obama's first term because we had people willing to stand up. However, it was also mediated by the insurance industry, and they got all the things on that Obamacare that they wanted in order to get it passed. So, we're still dealing with high costs. We're still dealing with subpar care, and we can do a whole lot better. I think that Bernie Sanders is still one of the kind of voices in the wilderness who are advocating for universal health care. And I've even heard the current president mention, things that suggest he's even thinking in those terms as well. And I know with the, ongoing trial with Luigi Mangione, there's certainly, public opinion that is awakening to the debate, right?
Actually getting people to talk about it. But this society is so ridiculous in that everything is so profits. And I agree. Like, if you're developing clothing, or if you're developing a new, technological tech device or technological software, profit motives are actually beneficial to society in general. But when you're talking about the practice of medicine, when you're talking about the practice of just healing people, if profit motive is the North Star, you're not going to have the best healthcare.
No, absolutely not.
This has been proven consistently over time. You're not going to have good healthcare if you have a profit motive, and that's your North Star. I agree with profit motive, and I like capitalism for a lot of things, but not for the practice of healthcare. And one thing that really disgusts me, and I've seen like people become popular on Twitter and things like this, promoting certain aspects of this type of business, but private equity buying out hospitals is one of the worst things to happen to us.
Yeah, absolutely.
Where we buy out hospitals, and then we do everything to cut costs that could potentially help patients, and we do everything to maximize the amount of beds we're using, and we kick people out of the hospitals. Whether you think this is legal or illegal. It happens consistently where
Yep.
people, because of a profit motive, people need to hit numbers. They encourage people to be, kicked out of their hospital beds. This
Sure.
happens, right? It's not like just a made up thing that we're just talking about here.
No, absolutely not. I mean, and
And
there's a
also,
couple. Yeah, go ahead.
and we're also like surgeons and physicians are encouraged to do more procedures, and there's a conflict of interest in terms of whether the patient needs something and whether they're whether the physician hits their numbers for the week or the month or whatever the case may be.
Yeah, that's right. Not to mention that doctors these days have to be covered by massive insurance policies, right, in order to practice medicine because they're getting sued as well. So there's two things that I think people should not profit from. One is providing healthcare for people and keeping people healthy, and two, especially if we want to have a strong country and if that's our motive. And then two is the imprisonment of people for profit, right? So there's a for-profit prison industry that is also being invested in by our legislators, and some of the first Trump administration were partners in some of these private prisons. And when you have private prisons, you have things like the Heritage Funds Project 2025. The Heritage Funds Project 2025 is boosting the building of these private prisons and then trying to get tougher laws to populate those prisons so that they can profit off it personally. And that is wrong to the definition. It's just wrong. So they're trying to incarcerate people in these detention facilities that are being set up around the country right now for immigration challenges that we're having are for-profit private prisons and detention centers that are run by these private equity firms that are profiting off of imprisoning people. So of course they want to make everything illegal. Of course they want to detain people for deportation. They want to get as much traffic through those systems that the federal government then pays for. So our tax dollars pay for that as well. So there's a level of disgust that I save for two things. It's privately profiting off of people's health and imprisonment. It's absolutely atrocious, and we are number one in the world with both of those things.
Ridiculous. And when you hear about political donations given to prosecutors or judges,
yeah. Well, that's illegal. That's bribery. But now we're catching them. Now we're actually catching them in the act. And then Trump went and pardoned them, the ones that were caught sending kids to prisons.
I've heard of criminal defense firms donating to specific judges, judge campaign. This happens all the time. This is not a
controversial topic. It's factual. This is happening.
Topic. Yeah, criminal defense firms are donating to get judges elected.
Yeah, that's horrible, right?
What does that tell you? What does that tell you?
It's profit over people, baby. Yeah, profit over people.
Yeah.
So we need to get back to the values that make us, liberty, freedom, equality, justice, the rule of law, and faith, and when you have those values in place. And I love it when Sebastian talks about values over loyalty, because that's exactly what we need to do. If we're true to our values and we believe that everybody deserves to eat, have shelter, and if you work a full week's worth of work, that you get to eat and have a place to stay, that you're safe, and all of that's being stripped away.
I don't want people to think that I don't care about profit in terms of people, corporations being able to sustain themselves.
Sure.
I don't want people to think that, like, corporate. But when your North Star is profit, that when you're the apex of what you're trying to accomplish, at the apex of that is profit.
Yep.
That is not good. And
capitalism is set up for infinite growth, right? They believe that there's infinite flexibility for growth, and it's got to be.
I'm a capitalistic person. I love capitalism. But in what areas is capitalism used? What industries? Right. Capitalism is great in certain industries. If I'm developing a software, amazing. You can scale it. You can make a lot of money. And then contribute to society in a lot of different ways. Innovation in healthcare, perfect. I love capitalism and innovation in healthcare. But when it comes to the practices of healthcare, when it comes to, I wonder what the mindset of someone who goes into private equity buying out hospitals. What is that the person's mindset that goes into that?
Told you, man, it's hard to be an investment banker and maintain your soul. My dad was an investment banker, and he told me that, and I told you that before, is that's the one thing that is difficult to do because you have priorities. What are your priorities? Is it your values or your profit? And I think I go back to my mantra is first add value, then create mutual value, and then capture value. And so I'm expecting a healthcare provider, and also in a free market, people have a choice of where they can get that service, right? And so even in the States now, you have certain, providers that you're selecting, whether you're, getting your healthcare through your employer, you're a captive audience. You don't get to choose. If we had a truly free market system in healthcare, you'd be able to choose your insurance company, which pool you jump in based on the benefits they provide, the value propositions for your segment, and it would quickly change the game. Right. So if you got to select, oh, I want to go with this company over that company because they provide the best care dollar for dollar. You have the best service, the best hospital access, the best network, blah, 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 blah. I want to sign up for the Cadillac of healthcare, right? Because that's what
to me, that's real capitalism and not cronyism.
Right.
What we're dealing with right now is cronyism.
Yeah, for sure.
Where people just buy the system, buy access to the system and control the system, which is really, really not great for society. But I also think that one criticism of Obamacare, I'm in favor it's the best system we have. It's not I think it's the best system we have. I don't think it's optimal, right?
Yep.
But the controlling costs is an issue. Inflation is an issue in terms of the spending that comes along with Obamacare. Premiums rising, it can be an issue. So that's why I'm a huge advocate of federally
Bernie Sanders, right?
Yeah, I'm a huge advocate of federally mandated, state-run universal health care. That makes sense.
Yeah, no, it makes sense totally. I want to just kind of go ahead. I want to kind of drill down on Bernie Sanders kind of talking points on healthcare, and I think that he makes some great points, and I think you'd agree. Listen, this is his statement on healthcare as a human right for all, right? Medicare for all. He says, we say to the private health insurance companies, whether you like it or not, the United States will join every other major country on earth and guarantee healthcare to all people as a right. All Americans are entitled to go to the doctor when they're sick and not to go bankrupt after staying in the hospital. His key points are this. He wants to create a Medicare for all, a single-payer national healthcare insurance program to provide everyone in America with comprehensive healthcare coverage, free at the point of service. So you walk in, they don't ask you for an insurance card, they don't ask you to pay a copay or whatever it is. There's no networks, no premiums, no deductibles, no copays, no surprise bills, and that Medicare coverage will be expanded and improved to include dental, hearing, vision, and home and community-based long-term care, inpatient and outpatient services, mental health and substance abuse treatment, reproductive and maternity care, prescription drug, and more. And to stop the pharmaceutical industry from ripping off American people by making sure that no one in America pays over $200 a year for the medicine they need by capping what Americans pay for prescription drugs for Medicare under Medicare for all. So when Biden was in office, he capped insulin costs, right, to like $35. And as soon as Trump got in, he signed an executive order reversing that action. I mean, these are things that really matter to people. These are the bills that add up every month. And if you're paying thousands of dollars for a life necessary medicine like insulin, I mean, how inhumane is that to say, hey, guess what? You can't afford your insulin this month, so you're going to have to ration that. And oh, by the way, you might die. People have died as a result of the cost of insulin rising. And I think that's just one key kind of illustration of where we are as a nation, right? And then we have Ozempic, who, we're talking about charging people $1,500 a month to stay skinny on something they're going to have to take for the rest of their life. We have our values completely on their head. And I think we need to evaluate that, as citizens and decide what we want going forward.
So here's a point of contention that I have with you. So Donald Trump did. I don't want to get too much into politics, but Donald Trump did cap insulin.
Politics are everything, Frank.
I get it.
They touch everything.
I get it. But in healthcare,
okay. Sure. So go ahead.
I think so. Donald Trump did take steps to cap the insulin costs at $35, but
Biden did.
Hold on. The scope of the implementation was different compared to Biden. So let me just clarify this. So
yep.
So there's just a different approach that they both have.
Yep.
So Biden mandated it, and then Trump made it a voluntary program to be involved in it. The government would help with the costs, but it was a voluntary program. Meaning, if you had a $35 insulin cap on your insulin, you could be a competitive. You can compete with other insurance companies that don't have that voluntary program. So I think the it's not necessarily okay. So it's not necessarily that the administration didn't want to cap the cost at $35. They wanted to create competition. That was the focus. That was underlying philosophical difference between Biden and Donald Trump. Biden wanted to cap it and mandate it, and it was mandated by the government so that people
Right.
could not charge above $35. Donald Trump wanted to help the insurance companies, but it was a voluntary program as a way to compete with other insurance companies. I don't know enough about whether what program is more effective. I just know that both of them wanted to reduce the cost of insulin, both of them.
Yep.
But they just had different methods of doing it.
I get it.
That's my understanding of it.
Well, let's talk about insulin. So go back to the beginning, and Frederick Banting discovered insulin in 1923, and he refused to put his name on the patent. He felt it was unethical for a doctor to profit from a discovery that would save lives. So this is one of the instrumental characters in the diabetes kind of disease state market, right? And he said that no one should profit from, especially the doctors or other companies, from being sold insulin. Now, today, obviously, we have got a lot of manufacturers of insulin. They're constantly changing the formulation or the delivery method or otherwise to make it more convenient, last longer, be more effective, et cetera. And they patent those iterations on insulin. But, it was a fundamental part of insulin's invention or discovery that we needed to find a way to provide this to people who needed it, right? This is not something they chose. This is something that happened to them. Patients with type 1 diabetes did not choose to have this affliction. It shouldn't be a requirement to pay anything other than the manufacturing cost. This is where profit over people, demonstrates itself the clearest, right? If you need to take something to stay alive, you should not be required, right? It doesn't cost you money to breathe the air you're breathing, but it needs to be protected so that we can continue to have that right.
So what I don't like is when we have these discussions and people are demonized on both sides.
Yep.
So I don't what does that accomplish? It doesn't accomplish anything. If we actually if scientists, if everyone involved in the healthcare ecosystem just talked with each other and didn't assume and didn't demonize the other side, we would get so much more accomplished.
Maybe, possibly. But if there's individuals who are specifically enriching themselves from this, then we need to know who the culprit is. You need to know where the conversation starts.
We need to have them on a podcast, and we need to call them out and have a debate about it and get the general public to understand, because the general public, if they understand the stupid ideas, then they can vote these ideas out.
Yeah.
You know what I mean? So so here's the thing. So one of the arguments I just want to play devil's advocate for a second, but one of the arguments on the other side, on the Republican side, is that it costs too much to have universal health care. It's wrong to mandate the government to force doctors to perform procedures that they're not fully paid for and they don't want to do potentially. So that's an argument that's made on the right side. But I also think that so how would you rebuttal that? How would you rebuttal?
I'd say that's it's a fallacy that it would cost more to have universal health care. When you take out the middleman, there's plenty of funds to go around to pay for the care, right? If you take the insurance player out of that equation, there's no such thing as limited funding, right? You would actually save the government $1 trillion every 10 years from having universal health care, as opposed to providing a substandard level of care with the insurance.
It's a great one. In the middle. Do you advocate more for state-run universal health care versus federal?
You're talking about something like Romney Care? Listen, I'm from Massachusetts. I didn't grow up here. I grew up in Connecticut. And I'll tell you a quick story. In 2000, want to say it was 2007, early 2007. Um, I had just gotten my first really, really good job, was doing really well. And for about 18 months, life was grand. And we had Ben. Ben is our oldest. And in July of 2007, Ben was born. About 6 months in, my boss came to me after a board meeting and he said, "Hey, listen, our program got shut down, and we're not going to do this anymore." And I was shocked. It was the first time I'd ever been laid off in my life, and I didn't realize what that meant to me and my young family. And so I said, okay. And they gave me a pretty good package, and they gave me 6 months to find a new opportunity. And that was great. But what the state of Connecticut did, because we were either on a COBRA or, we had the ability to provide our own healthcare under a COBRA. But the state of Connecticut stepped in and provided Ben with a Anthem Blue Cross Blue Shield Cadillac of healthcare under the Husky program, and basically covered his healthcare from the point he was 6 months on and for the next couple of years, because they want to have a healthy population in the state of Connecticut, right? That's something the state mandated, that all toddlers or all, babies in the state of Connecticut were going to have healthcare coverage. And what I didn't understand was that it also covered me and it covered my wife. So all three of us all of a sudden had Blue Cross Blue Shield healthcare that paid for all of our healthcare. There were no copays, no anything, no cost, to the point where even when I was employed 6 months later with a great job that had healthcare, my employer forgot to file the paperwork to have me covered under healthcare. And we were still covered under the state of Connecticut for a full year and a half. So the means are there. The states can provide that healthcare. They can mandate that insurers in their state provide healthcare coverage. It was a benefit I didn't realize how much I needed at the time, but it was extremely helpful as a young family to provide for our family, right? And I think everybody should have that safety net. I'm more than happy to pay healthcare through my employer now, and have the Cadillac plan that they offer. I always opt for the best options. But like I said, I can also see it from the side of an entrepreneur starting a business or heading out on your own and wanting to have healthcare coverage and having to go into the marketplace to buy it. If it's the state-run marketplace, it's a smaller pool, and therefore the premiums would be higher, the deductibles would be higher. I think we do this all to appease the healthcare industry and their lobby. I don't think it's necessary. I think that the state can certainly provide that administrative overhead and take the people out of private industry, put them in the state-run program, and let them provide, right? We'd use a lot less employees, and it would be a lot more efficient. But there's no way it would cost us more. Now, it's challenging state to state, right? If you go to the state of Massachusetts, I think the income in the state and the revenues the state generates are going to certainly give us a better healthcare system. If you go to other states that are struggling financially and don't have the output or GDP that the state of Massachusetts does, you're going to have a hard time providing that same healthcare for a population that's similar. So I think it would have its challenges, but I also think the free market would dictate and people would move to places that provide better healthcare, right?
Yeah, exactly.
There's mobility issues too.
I want the states to compete.
Yeah, right. Imagine that if they had to compete, right? So today, people are going, they're moving from California to Texas. They're moving from Florida elsewhere. Because of costs and constraints and government and politics and policies and all these things. Medical tourism is also huge too. People go to other countries to get medical procedures for less, including a week of a stay at a spa, so that they can get top healthcare, right? These are American doctors in Costa Rica or other beautiful places that are providing lower cost healthcare without the insurance company involved, out of pocket. And I just think there's a lot we could do that's better than what we've got.
Yeah, I think I think if we put a focus on merit with regard to the states, if you have better health outcomes, and then but here's the thing, like value-based care. I was talking to I was talking with a surgeon on value-based care, and the surgeon said, when you talk in our circles, it's kind of like ridiculous that this is true, but he said in our circles, if you mention value-based healthcare, you'll be laughed out of the room.
Yeah. Well, that's
which is
because there aren't a whole lot of examples of value-based healthcare today, right? There's a few limited examples that are working and you can point to as examples. And everybody's saying, oh, value-based healthcare is it's coming, it's coming, it's coming. But show me a tangible example. And there's a handful. But it's not something that is here presently.
I don't understand why. What would be the objection to value based healthcare? Just for the audience that's listening, value based healthcare is you providers get paid more based on the results
outcomes.
that they
That's
get.
right.
Yeah, the results that they get. So the
Yep.
outcomes that their patients obtain. So
Yeah.
So what if you're doing something that is measurable, and the only way you can do this is with something that's very measurable, right?
Sure.
Why don't we benefit the providers that are providing these healthcare services and pay them more if they get better results? Wouldn't that
Yeah.
change the kind of nature of how healthcare is done? So I get the idea. That's very difficult. Like, for example, if you tell somebody, if you're a gastrointestinal doctor and you say eat healthier and your gut's going to improve and you're going to lose weight and things like that, how can we measure if somebody actually follows the steps they need to take in order to lose weight? It's very difficult to do that, right? So
Yeah.
why don't we find things that are very measurable, like
Yeah.
Well,
like if it's black and white, if it's curative, right? If let's say you're talking about stem cell therapy or CAR T therapies or things like that, where it's black and white, it's either curative or it's not, right? And the healthcare providers, and we've talked about this before, the healthcare providers will, if it's curative, then they'll pay. And if it works, they'll pay. If it doesn't work, nobody pays, right? So that's a challenge, right? Because you're developing, billions of dollars in R&D in order to go into the red, and then you've got to climb back out of that by having payment. So it's not as simple as that. It can really skew the equation, and that's why a lot of these, curative treatments are being sidelined because it's not profitable, right? So
I hate the idea that healthcare is so convoluted, and it's just such a horrible system that physicians in mass are quitting, and they're not wanting to practice medicine. First, because the system sucks. They're dealing with insurance companies a lot of the time. They're getting abused sometimes by the hospital system as well as the patients, and the patients are. I had this issue with with my family. I was so pissed at the healthcare system that I took it out on healthcare workers. I was so pissed at it because of the situation that my dad was in, and that happens consistently. It's so horrible. The healthcare system, the fact that they're like almost everyone, whether rich or poor, the poor are more affected, to be honest. But rich or poor, if people have dealt with the healthcare system and something happened where there was an accident or somebody was misdiagnosed or they're giving certain medications or they got like one of the issues that we talked about this, but getting proper tests, right? CT scans and things like that. One of the things in healthcare is what the way I understand it is the reason you want to give everyone CT scans is because you could freak out the patient and you could over treat a patient based on the results that are received. So I understand that, but there's just it's so
we don't want to miss anything. You don't want to have a liability, right? So they run all those tests so they don't miss something, right? So they're covering their ass, right?
Yeah, but one of the things is when a patient asks, right, for a test, sometimes like it's not ideal to give it to them because you may overtreat them. You may get false positive things like that. But the thing is, patients, because of the way the healthcare just spits them out of the system, a family member could experience this. This is like, I think this is ubiquitous across the nation. People have a family member that had a really horrible issue in the hospital, right?
Sure.
And what it was, maybe somebody was being misdiagnosed. Maybe they were given the wrong pill, for example, which happens consistently. People are like, the hospital systems aren't always organized. There's people that are there's a lot of retention problems with nurses, physicians, and there's always new people coming in, people going out, and so there's issues, there's miscommunications between like the different shifts, the different physicians and nurses that go from shift to shift, and so things happen. medical errors happen. And when these medical errors happen, and it happens to a lot of people across the nation, the family members experience this, and then they become furious,
Oh yeah.
furious system. And then what happens is there's perpetuating, cycle where the families get mad at the physicians and the healthcare workers. The physicians and the healthcare workers quit consistently,
Yeah.
and then the system doesn't fix itself, and it consistently happens that way to where it's perpetual. It's consistent. People are quitting consistently. People are being treated horribly on the provider
Less resources,
side, the patient side.
more overworked.
Yeah, it's just it's just a horrible system, and we're trying to fix it consistently every day. But I don't know.
But the only way to really fix it is with legislation, to be honest, right? Because it's not going to fix itself unless it's under constraints.
Technology can make a dent.
It can only do so much if it's not required. You can only do so much if it's not required. Meaning, regulations require everybody to get on board and go in a certain direction and adopt certain technologies or adopt certain policies. And unless it's required, they're not going to police themselves and do it, right? And the insurance companies aren't going to force them to do it. But if legislators, make it a mandate as opposed to a suggestion, things get done. So anyway, that's, there's a lot of feelings around this topic, right? Because this has affected everybody, right? It's affected you personally. It's affected me personally. I know my mom as a nurse would go, and when she's, you're taking on a shift and somebody's getting off a shift and they're putting in notes, everybody's rushing. Everybody's trying to get, home. Everybody's trying to do all these things. I remember my mom telling me one time she went into a patient's room and she was picking up this patient. Somebody just left their shift, and they left in the notes that somebody was supposed to get 4 units of insulin when it was actually supposed to be 0.4 units of insulin. So leaving the note for my mom, it says, hey, give this patient 4 units of insulin. If my mom had followed that direction, she would have killed the person. Instead, she checked it and said, oh, actually, it's supposed to be 0.4. They did the calculation wrong, and, nobody died. But that happens every day. People get those 4 units of insulin and people die. So yeah, I
tell my wife every time, one of our children gets sick, we don't need to send them immediately to the hospital. The hospital is not as safe as you think it is.
No, it's the number 3 cause of death.
It is a dangerous place.
Yeah.
But to be fair, it causes more life than death.
Of course. What's your favorite hospital show, Frank? What hospital shows are you a Grey's Anatomy guy, or what do you watch?
I don't watch those shows, but I would say Grey's Anatomy probably, or there's a new one out. I think it's
The Pit.
Called? The Pit, yeah.
Yeah, really good with Noah Wiles and so he was the original, med student on ER. Love that show, The Pit. And then after watching The Pit, had to go back and start ER from the beginning, from scratch. And it's compelling, but it shows you not only the human cost of this, but what the doctors go through, what their staff go through, juggling more people than they should have to in an emergency environment.
Makes you think, why would anyone want to be in the healthcare system practice?
I don't know, man. It makes me second guess and saying maybe I should have gone to med school. I like that kind of environment. I thrive under those kind of crazy conditions, but the stuff they're performing while they're under those crazy conditions is incredible. And if you know a healthcare worker, these are the good guys, right? They got into it to save lives. They got into it to help people. We should not take it out on our healthcare workers, Frank, but we should fight for them to have better conditions, more resources, right, available to them. And it's frustrating, right? They're the person that's in front of you at the time that you're getting this subpar care, and you want to take it out on somebody. It's frustrating. But those are the good guys, and they got into it, and they are leaving en masse because of things like COVID and the pandemic and being overworked and understaffed and under-resourced. It's terrible.
To be honest about that, because I've had horrible experience, and I did take it out on some of the healthcare workers. Like, I was just very kind of abrupt and rude. And at the time, I was trying to protect my dad. I'm like, I don't want this to happen.
Yeah,
of
course.
So to be fair to myself, I was trying to help my dad not experience the same thing. But it's understandable for someone to be in a situation where they're given a medication and their family member has an adverse reaction to the point where it's debilitating. It's understanding for that person to go, what the hell is going on? And just to try to understand why something like this could happen to their family member. And then it's very difficult in that situation. While
Yep.
it may be wrong to lash out, it's understandable that somebody can be so frustrated with the
Oh,
system
I totally get it. I totally get it.
that they get mad at the system, but also the sometimes the workers. Unfortunately, that's just
Yeah.
I'm just saying this from my, because I'm a a temperamental guy. I'm not gonna lash, but if something happens in my family, that's something that's a different story.
Yeah, so it's everybody's family. And here's the thing is that the current administration and the powers that be are going to try and take away Medicaid and Medicare
I
and
don't think that's
and
the case. I don't
yeah, it
think
is.
they're
It
trying
is
to
the
take.
case.
I don't think they're trying to take it away. I think they're trying to make it more efficient. Now, are there mistakes that are going to be made? 100%.
So
I
we
see.
just said it's understaffed, under-resourced, underfunded, and now we're going to take away people's jobs and put more on the people who are staying in the system. So it's a challenge, man, and it's going to get ugly. There's going to be people being let out of state-run facilities because they don't have anything to pay for it. Their family can't pay. They're going to be living with younger generations, putting more stress on the family, putting more stress on people trying to get to work. I mean, it is going to turn into a cluster if they take away Medicaid and Medicare.
Again, my position on
What they're
this
trying to do is privatize it so that there's private companies that come in and manage that. At the same time, it's not something that can be done, by the current administration. They don't have the capability or the competence to do it.
again, my position on this is that if we're getting rid of waste and abuse, great. If we're gonna impact patients in some way by cutting costs where the particular costs are needed, that's not something I'm in favor of. Now, this is a tricky where like it's a tricky thing to manage. It's a tricky complex process,
Sure.
and we can criticize them all. I mean, they're there to be criticized, right? But I think for the most part, we're trying to do the right thing by managing waste, and that's just my opinion on it.
I just think that's a convenient term to throw around waste and fraud and abuse when they're constantly involved in waste, fraud, and abuse themselves. So I think it's something that needs to be managed under legislation with the proper channels, as opposed to going in with someone like Elon Musk and cutting costs and cutting headcount. And RFK Jr. today just announced that they're going to let go 10,000 people from Health and Human Services, 10,000 employees, essentially gutting the agency. That is going to have direct impact on the next pandemic, our preparedness for it, our ability to respond to it, and the ability to run healthcare in the U.S. 10,000 people is not a small cut. So this is it's chaotic, it's destructive, it's not done in an intelligent or systematic approach. It's going to kill people. People are going to die as a result of
My
this
opinion is
irresponsibility.
what we've been doing has not been working at all. So there needs to be a major overhaul. That's my opinion on it. It's
Right.
what we've been doing consistently. Now, we don't know yet whether they're going to be successful at what they're doing currently, but and I'm skeptical 100%. I'm not cynical though, and I think too many people are cynical and they're trying to get have gotcha moments where they're trying to demonize people based on mistakes that are made, and I just like how do we come together and try to do what's best for society?
That's a good question. Call me crazy, but I just don't think a former or a heroin addict should be running Health and Human Services to begin with. But what do I know? So
I mean, we all everyone has a past to
we
some extent.
we
Some
we all
people
have a
worse
past.
than others.
Decades of heroin abuse is I don't think so. But I
But do you see drug
disagree.
addiction as a disease, or do you see it as a moral ineptitude?
I think it's a little bit of both, to be honest. I think it's a
You
little
think
bit of both.
taking a drug?
I think addiction happens in a lot of different forms. I think people go to the doctor and they have a prescription or they break a bone and they go home with a medication. Some people end up seeking on the street and finding, a fentanyl, laced drug that ends up taking their life, and maybe they get addicted. But I think there's also people who are seeking and have addictive personalities that find themselves in the throes of it.
Why are we so black and white about things like this? Like, okay,
Yeah,
for example,
I'm not. I don't think it's. I don't think it's all the same.
Hold on. If one of my children
Yep.
Was at a party at some point, and they were, in some way guilted into trying something. Hey, I
Yep.
want to try this, and then they become
Somebody says,
addicted,
"Hey,
and
yeah,"
then
or "Hey, take a
they
Xanax,"
get
and then
peer
they
pressured.
overdose on fentanyl.
They get,
Right.
let's say they get peer pressured into taking fentanyl, or and I know how I raise my children, right? But there's certain circumstances that could
Sure.
potentially happen, and then am I going to demonize my son or daughter because they became addicted to something in a peer pressure situation? So
Yep.
every circumstance requires analysis,
Of course, and empathy and compassion and all those things. I understand that. I get it. I get it.
But so why are we demonizing without contextualizing? Why are we on both sides?
Well,
I don't care. On both
I'm
sides.
going. I'm going on. No. I'm going on family members' direct uh, opinion and perspective on an individual. Right? They said this guy is not who he says he is. He's a monster, and he had 20 years of heroin addiction. I think he was an entitled, addictive SOB, right? Whose infidelity and everything else is on full display. So in this case, absolutely not. I will judge the character based on those around him who have had colorful commentaries on who he is as an individual. Would I want him anywhere near healthcare? Absolutely not.
Okay, but would you? I understand. You,
No.
you have a character issue against him. I get it. But would you want him to succeed? And would you want to help in any way to help someone in that position to succeed? Whether you like,
I don't think he's capable of success. I think he's a damaged individual.
That's cynical, though.
So it is cynical. No. I'm cynical because he is a. It is well known what he is. It is well known what he is.
Yeah. So
right. There's no unknown factors there.
In my opinion,
you can give somebody the benefit of the doubt and give them empathy and compassion. He is run out of that as an individual. There's none left to give him. Right. Same as Donald Trump. Same as a lot of people. Because they show what their true colors are, which is personal profit and entitlement.
In my opinion, being cynical on both sides is unhealthy. If we're being cynical towards Joe Biden, or if we were being cynical, that was bad. We can point out criticisms, no problem.
Sure. Yeah, absolutely.
Like everyone,
and listen,
if you're in politics, you deserve to be criticized in some way.
You do.
But to be cynical is different. Being cynical is like, I don't care what you do, I want you out, and I want to do
because he's dangerous. And there's certain people who are dangerous and have profit for their own benefit and enrichment for their own benefit as their main motivation. And it's clear to me that this individual does not have the American public's best interest in mind, right? So he is I'm just going to leave it there. Listen,
I will retract my statements, but I'm willing to wait it out and see how he does in terms of.
It would be a miracle. And listen, no one's beyond redemption. I think, people have the ability to change, and, people have the ability to heal and develop and all that good stuff. Great. I will give you the benefit of the doubt all day long if I think you're willing to do that. But this guy is a maniac. It should not be near any federal levers of power, should not be elected, unelected, or in any position of leadership, period. Okay. That's my opinion. Based on his history.
I'll tell you what I dislike, and I'll tell you what I like. Just to make an argument.
Hit me.
Play devil's advocate. What I dislike, obviously, he has a bad past. He has family members that don't really aren't really supportive of him. Fine. What I do like is okay. What I also don't like is, and I think he's portrayed as a cynic regarding vaccines, but I don't think that's necessarily the case. In terms of, I think I personally am an advocate of vaccines, but I wouldn't say the right way to portray him as a cynic of vaccines.
But he is, though, because you can listen to everything he said publicly. He's on the record in so many different cases where he does provide a cynical outlook on vaccines. He does spout off on things that are unscientific, unproven.
From the perspective of someone who's dealt with the healthcare system, for example.
Yep.
And one way that people can lash out is be anti-establishment, anti-institutional. So I can understand from that perspective how someone who has a bad experience with the healthcare system can go, screw the healthcare system, screw the science behind it. I like, there's something shady about it. I don't trust it. I understand that sentiment. Do I think it was carried out in the right way, or it was portrayed in the right way, or it's projected in the right way? Probably not. But the idea of talking, like, I am not, like, what I am not an advocate of is for science to become a religion. I love science, but real
Yep.
science, not religion.
Sure.
I don't like the religion of science, which means which tells me that something is a religion as opposed to science is if you looking into something is people lash out at that. People say people demonize you for looking into something. So, for example, do I believe in vaccines? Yes. Do I want to look into and do more research on them? Sure. But that I'm not cynical. I'm skeptical of new vaccines that come out. I want to know what's in them. I want to know, how people are reacting to them.
So if you wanted to study more about vaccines and you want to do more studies, wouldn't you want to hire more people to be part of HHS? Today, RFK Jr. on Thursday said the agency would axe 10,000 full-time employees spread across agencies tasked with responding to disease outbreaks, approving new drugs, providing insurance for the poorest Americans, and more.
Okay.
The cuts are in addition to roughly 10,000 employees who chose to leave already through voluntary separation. So that's 20,000 less people than we had last year, right? And the workforce would shrink to about 60,000 people to cover the department and its 10 regional offices. So this is going to affect poor people the worst, right? They're going to have less health care. We're going to have less approvals of new drugs and things that are on the market, less testing. I mean, it's not going to work in terms of cutting out corruption.
What I do know is the last 10 years or the last 20 years or the last century have not been working for us as a society. Do I think there needs to be a change? Absolutely. Do I think, am I sure that this is the way we need to change things? No. I want to see how it pans out. But what I do know is that we can't keep doing the same thing expecting a different result. That's a definition.
Yeah, sure.
And right now,
thank you for the Einstein quote.
Yeah, and the last 100 years have not been conducive to. I mean, trust me, like I am a believer in traditional medicine, and what we've done with traditional medicine has saved millions and millions of people, and we've expanded lifespans, health spans, everything in between. But there's also extreme inefficiencies in the system. There's the way healthcare is run currently is horrible. What we put in our foods is horrible. The fact that we even need Ozempic to stave off, hunger, the hunger that we have on a consistent basis is deplorable. To be honest, It's like what we're putting in our foods is so deplorable, and with a profit margin. Yeah.
So every broken clock is right 2 times a day, right? So RFK, I agree. There's stuff in our food that shouldn't be there. What has he done about that? Right? Nothing. He talks a good game, but what has he implemented? Yeah, well, they're doing a lot of things to do damage. Show me one positive thing that he's done or suggested, right?
Okay. Well, if we're going in with a hammer and trying to like break things, like we're like a bull in a china shop, that's what's happening today.
That's what's happening today.
That's not what I like.
What you're advocating for.
What I do like is the concept of looking at the system, looking at the science, and being more transparent and seeing if there's something we can improve on. That's the only thing that I advocate for. But what happens is, what I don't like is when you look into something and the powers that be, or the institutions that be in terms of healthcare and medicine, go, let's not look into that. That's ridiculous. That's why are you even doing that? Now, I understand the argument if you're talking about vaccines, that you don't want to create vaccine hesitancy amongst the population because that hurts herd immunity and things like that. I can understand that idea, but if your idea is so strong, you're so confident in your idea, that doesn't show me if you're trying to dissuade people from talking about things, that doesn't show me how confident you are about it. That just shows me that you would have to assume 2 things, really. You'd have to assume that people aren't smart enough to get the information and delineate between bad information and good information. You have to assume
check.
In order to block people, ban people, whatever the case may be. You have to assume the underlying assumption is that people are not smart enough to find the information and do what's right for their family. That's the first thing. The other thing you have to assume is that people have nefarious motives, meaning they're spreading misinformation because they're evil and they're the devil, they're whatever the case may be. They're nefarious in nature. You have to believe those two things, that people are nefarious in nature that are conversing about this.
And so let's define that. What makes someone nefarious in nature?
What makes someone nefarious if their intentions are impure? If their intentions are impure, yeah.
So what would characterize an individual who might be in charge of a healthcare system as nefarious? How about loyalty to your spouse? How about the things that make up someone's character that determine if they're a good person or a bad person, a person of goodwill versus a nefarious person. So I'm saying that this individual is nefarious based on his past actions and his current behavior, and therefore should not be trusted to have people's best interests in mind. This is a good
conversation. Would I prefer my heart surgeon to be faithful to their wife? Yes. But what is more important, for them to be really good heart surgeon, or for me to know about whether they're faithful to their wife or not? I don't know. I prefer for them to be just a really good heart surgeon. I don't really care. We talked about
judges taking bribes for, private prisons and things like that. It's the same principle. It's the same principle. If they are if they're compromised as an individual, if they've demonstrated through their past behavior that they have bad intentions, they're disloyal, their infidelities and everything else, if they're a compromised character that can be bribed or compromised with information about their past life, then they shouldn't be in government. They shouldn't be making legislation. They are compromised. And RFK is an example of a compromised individual. Donald Trump is a compromised individual.
I hired an employee to edit my videos.
Yeah.
Do I want them to be, for the most part, why would I care if they're a perfect person in their past, in their personal life? I just want them to do a good job.
I remember when I worked in retail and I'd have to do a lot of hiring for employees during the holidays, and I would have to ask them a question. Hey, if you knew that someone stole $1 from the register, should they be given a second chance? And what is the answer, right? If you knew someone was stolen from you, would you give them a second chance? The answer is no, right? Yeah. So in this particular case, and in Donald Trump's case, and in his entire administration's case, whether it's Pete Hegseth or Marco Rubio or any of these individuals, they're compromised. They are compromised, and therefore they are going to only do what's in their best interest. Yeah, right.
You can say that about any politician, any congressman, people, the Congress people, the senators that are.
You can't get into Congress unless they have something on you, right? Unless you're compromised in some way where they can hold it over your head. That's the only people that are allowed to serve, are people that they have something in their back pocket to say, hey, listen, I've got this, and if you act out, I'm going to expose you for it. And I truly believe that. I believe that half of our Congress, at least 360 of the full Congress, are compromised, period.
Yeah, agreed.
Put that in the show notes. Yeah. So it just, I don't know. I'm not perfect. I'm not a perfect human. I have my own flaws. At the same time, it's about intention. It's about whether or not we're dealing with bad actors. And I think that the people who are running the show right now are bad actors. I think they have their own best interest in mind. They're looking to enrich themselves and create a government where there's no elected officials, but kings and queens.
When I was 18, I did a lot of stupid things. Do I want to be judged by the things that I did when I was 18? That's the thing. So are we? So
what about in your 20s and 30s, Frank? What if it continued into your 20s and 30s and 40s? And what if by the time you're 60, you finally get your act together?
That's different.
Is it?
I get to act. Yeah. If I get my act together at 60, should I be judged based on what I'm doing now, as opposed to what I did?
Maybe. I don't know. If you did it for 3 decades, I would question any intentions after that, right?
Of course. Not everything's black and white. You have to look at everything contextually based on the circumstance, right?
Absolutely.
Yeah.
I always love the debate. No, I always love the debate. I think that's a good place to end. But I appreciate the candor and the passion. We're not going to solve healthcare and universal healthcare today, but I think the points are, there's a lot of waste and a lot of fraud and a lot of abuse in the system today, and unfortunately, it's coming from the people who are providing the care, the payers. I think they do a lot to stuff their pockets and take away the quality of care that we could afford in this country. I think we're one of the richest countries on earth, and we should have the best healthcare on earth. But I think there's competing interests by nefarious bad actors that stuff their pockets. No CEO of any healthcare insurance company or otherwise should be making $30 million a year. Period. It's absolutely outsized profit for taking away care and denying claims. So with that, I think we can agree that we need to get fraud, waste, and abuse out of our healthcare system. And that's the first place to start, is in the payers.
I think a rebuttal to that is that I think those are. Do you think every healthcare CEO is paid in the 30 millions, or
Let's look in the insurance companies?
One of my hospitals that my dad went to, the CEO was getting paid, I think, $200,000.
CEOs' salaries. All right, let's look real quick. Last show note. So 2025, boom. So as of March 2025, the average annual pay for healthcare insurance CEO in the United States was $82,367 a year. That doesn't make any sense, nor is it accurate. How much does a healthcare CEO make? The average chief executive brought home $11 million, where the median was $4 million, and those figures compared to the average of $13 million and median of $4.3 million in 2022. Who is the richest health insurance CEO? United Healthcare's Andrew Whitty benefited from a 12.8% pay bump.
Oh, yeah, the payers, yes, 100%. But what about the provider, like the CEO of a hospital, for example?
No. That's not what I'm talking. I'm talking about the insurance company.
I understand.
Whitty received $23.5 million in total compensation in 2023, the bulk of which came from $15 million in stock grants. So listen, there's a lot of waste, fraud, and abuse in our healthcare system, and it's not coming from the hospitals. It's not coming from the doctors. It's not coming from the medical device companies. It's coming from one source, the insurers, who ensure that we don't have universal healthcare and healthcare as a right as a human being.
It's a scam.
Yeah, it is a scam.
I don't know.
So anyway, we will get into more topics next year or next week. But Molina Healthcare made $22 million last year. CVS Healthcare total compensation $21 million. Then Cigna, Elevance, United Healthcare, Humana. There's a lot of tens of millions of dollars being paid out to these individuals. I think we can do better.
I'm sending a text right now.
All right.
We'll
Sounds good. Talk soon. Ciao.